So let's dive into some strategies here that are paramount when we think about addressing these healthcare inequities, right? So the first one is to create accessible resources. Creating resources in multiple languages and accessible formats ensures that information is inclusive and can be understood by a wider, more diverse audience, including those with varying language preferences or disabilities. And this approach will help break down barriers to access, promoting equity and ensuring that all individuals have the opportunity to fully engage with and benefit from resources that are provided. The next one that we have here is building community partnerships. Building a strategy without hearing from the population that you serve is an incomplete plan. And so it's important to build partnerships with organizations that serve the marginalized communities that you will be serving to hear about their needs without assumption. Also, we have here diversify the workforce. It is important for the workforce to mirror the population that you serve or get close to it. I know for me personally, having someone who shares my identity when it comes to healthcare is very comforting. Recently, as of within the past year, I will just share a personal story. I had been going to the doctor trying to figure out some issues. And I'm not saying that this happens all the time, but it wasn't until I found someone that shared my identity that was able to pick up on certain symptoms and issues that I'd been having to know exactly what it was and to diagnose me correctly. And so that diversification happening within the workforce, especially when we start talking about addressing healthcare inequities, is so important. And then taking it a step further and promoting that training and education. This is a continued journey. It's not a one-stop shop. And so we really put emphasis on promoting that implicit bias training to address any of those biases that you may have. And then finally, advocating for those policy changes, performing audits, really looking into the data to aid your strategy. And these are all things that NOVA helps with our clients. When I mentioned earlier on in the webinar that we were able to make strides with our clients within the healthcare industry, these are all pieces of the strategy that we were able to work with them on.
So organizational changes are great. And I also see in the chat here again, these are backed into our systems, backed into our policies and practices and healthcare and our training programs. So taking a look at it from the organizational level can start to make some of those changes, can start to implement some of those changes, and just being aware of where they come from, the systemic issues that they're arising out of. So that's what you can do at an organizational level, but you can also do things every day in your own life. Not everyone has the power within their own organization to make changes, to address the policy, to organize and put on a training. And that's okay. There are things you can do within your own life, within your own community, within your own family, friends. So each of us as individuals, we have a really important role to play in advancing health equity.